did our project for the 10 essential public health services on providing education among youth about the consequences of smoking in regards to heart disease and strokes. The goal of the first public health service is to assess and monitor population health status, factors that influence health, and community needs and assets. Because we are focusing on smoking in regards to heart disease and stroke, we will start off by monitoring heart disease and stroke hospitalizations and diagnosis and see if there is a correlation to people who smoke to find patterns. We would also monitor the amount of purchases of tobacco and nicotine in stores to see the demographics of the people who purchase these. We want to hold community meetings to talk about how people feel about smoking and all things related to smoking.
The second essential public health service is to diagnose and investigate health problems and hazards that harm a population's health. To effectively diagnose youth with heart disease, it is important to have routine checkups and to track their relatives' health conditions. Generally, heart disease is genetic, therefore youth who are predisposed to having heart problems should be monitored closely. In this step, professionals should investigate what causes young people to begin smoking and determine ways to prevent them from smoking at such a young age. They should also investigate which group of kids are more susceptible to begin smoking in order to help them cope with their problems. And another important measure is to analyze the correlation between smoking and heart disease to have more precise information. The next step in essential services is to inform, educate, and empower. In this step, health professionals should effectively communicate with people in their community to educate them about health, what factors influence health, and how to improve it. In order to prevent heart disease related to smoking, the youth should be educated about all the risks of smoking besides simply heart problems. And to ensure efforts are being well used, professionals should focus on the group of kids who are more likely to begin smoking and provide them with education, direct them with support groups to quit smoking, provide them with alternatives to alleviate stress or cope with their problems, and they should also empower them with the resources to maintain a healthier and happier lifestyle.
For the fourth essential public health service, we have mobilizing community partnerships in action. And what this means is that a community that mobilizes, they come together to take action towards their common need. Most of the times, community organizations are going to form bonds to solve that need together. So when it comes to our topic, youth smoking and the problems that can come from that with heart disease, some of the examples that can be done are having community programs be involved with one another to inform the young adults from partaking in smoking. So these groups come together and they have a common need of trying to limit the amount of youth smoking. So what they're going to do is they're going to come together and form bonds so they can combat the rising rates of youth smoking and hopefully prevent people from partaking in that action. Another thing that can be done is people can have community events. So these community programs that come together, they can put on events together that have the different leadership groups in the community battle against youth smoking and try and teach the people that attend the effects that it can have on heart disease. I've sort of related this to kind of like a Relay for Life event where you do the same thing like you would with Relay for Life with breast cancer and cancer in general, but you do it with youth smoking. Number 5, we have developed policies and plans. There's a wide range of possibilities when it comes to developing policies. But some of the things that can be done for our topic here are things like implement an anti-smoking class into the school curriculum. So this goes in line with education, which is another essential service. Developing policies and plans kind of goes hand in hand with that, with our topic, because you got to teach these kids that smoking is not good. It's been proven it has a bad effect on your health, and especially can play a role leading to heart disease. Another thing, like I was just talking about, is the Relay for Life event, but for smoking. So something similar to that, where the school will host an event on campus that funds an anti-smoking foundation, but the students are also able to have fun while learning about the consequences of smoking and how it can affect their the health of their heart. The last one I have is put a policy into place to combat the effects of peer pressure, because peer pressure really does have an effect on youth smoking. A lot of people don't just wake up one day and say, you know what, I'm going to smoke a cigarette. A lot of times that is influenced. their push to smoke is influenced by other peers, and that in turn leads to heart problems with smoking. So having a policy that talks about the effects of peer pressure and how that has a role on smoking.
The sixth step of the essential public health services is to utilize legal and regulatory actions designed to improve and protect the public's health. We must educate to shops that sell tobacco products about the dangers of selling tobacco to people under the age of 21 and increase the punishments of shops who violate this law. We would also push for the enforcement of disciplinary action for minors in possession of tobacco products. Also, we would also want to push random tests for tobacco and nicotine in schools.
The seventh essential public health service is to link to services and assure provision services. Basically, what this entails is you link those who are affected by a health problem to a needed health service, while also assuring that healthcare is provided to those affected. Some examples of this with our problem is, smoking becomes much worse over time. So you want to get to people early. So using this service, you would want to ensure that schools are linked with services such as The Real Cost, BeTobaccoFree.gov, in order to ingrain anti-smoking ideas early on. Another idea would be to make sure that young adults with smoking problems have services available in order to help them quit, like quit.com, the SAMHSA national hotline. And the third would be just being able to refer those who have already been affected by the risks of smoking, like people with lung problems or heart problems, have the right professionals available to help them with their situation.
After linking services to our communities, we have to assure competent workforce for our youth. So we have to make sure that whoever we hire, whoever is reaching out to the young populations about smoking, is willing and has that passion to actually share that information with our youth. So we would have to enforce new standards by ensuring we have a competent public health workforce to maintain the order. So we will provide resources to adults to inform children about smoking, allowing websites to provide information to adults, probably by mail, by email, any type of school-related information that could be sent to these parents, or we can also make sure that we're training our school advisors on how to reach the youth, inviting public speakers, inviting actual healthcare workers, nurses, public health officials to ensure that we are actually teaching them and that our information is best quality and is up to date. We also have to standardize workers to enforce laws and regulations towards selling and buying drugs. So make sure that none of this, there's no drug use going on between our youth, and ensuring that whatever policies we have in place, that these people are making sure that the youth follows them, so we know that there's nothing underground going on, and ensure information is up to date and accessible. After that, we would have to make sure that we have evaluated the effectiveness of what our policies and new standards are. So because this will allow quality of treatment and education to improve, and also manage the performance to make sure that we are giving the best quality care we have. So we would evaluate communities and youth populations to view if any changes happen. So we would compare if there's any difference, like before we had taught youth about consequences of smoking, making sure that their health is improving. Ensure all communities, especially those who impacted the most, have accessible information. Doesn't matter if they are impacted or not. We cannot have any communities that are not getting this information marginalized. No, we have to make sure that everybody has access to it. And we have to allow public health services and public-based services to investigate these communities' health to make sure that we can measure out and improve our care and review if teens understand the effects of smoking, and to make sure that the information is being given out correctly.
The 10th essential public health service is research. The basic idea of this one is just finding new ideas and solutions, new preventative measures, following trends in order to, help remedy the health problem at hand. With ours, doing research, it's very clear that smoking isn't the only thing affecting people in terms of nicotine. It's clear over the past 3 years that the use of vapes in high schoolers has gone up exponentially, as seen in the two graphs below. So through this research, it's clear that smoking shouldn't be the only target In schools, it should also be vaping products, just to curb any health problems with that as well.